Hello, students. This is Dr. Kubin. I'm going to try to give you a little bit of an overview of what's going to happen in lab this week. We're going to be doing something a little bit different. And so I want to try to make this a little bit more clear for you so you kind of understand what's going to be happening. I've given you your prep work and all of the things to help give you the information that you need before you come in, but I want to try to help you understand how the day is going to roll out when you come into simulation. So they're going to be, this week we are pairing, the S1s and S2s are pairing up again with your mentor mentees to work together to go through the activities. There are two different activities that are going to happen. One is going to be a prioritization and delegation simulation, and the other is going to be kind of a skills station thing where we're going to focus on the principles of sterility again, and this is going to be kind of in the form of a obstacle course relay race type of situation. So we'll talk about both of those things. I want to talk about the simulation first. And you've all been provided with this kind of student guide that kind of walks through this all of the things. So I'm going to kind of try to explain this to you a little bit. First of all, the purpose of this is for you to kind of assess your prioritization skills, your delegation abilities, looking at medication safety, and management of clinical interruptions in the acute care setting as well. Interruptions is not something we've done a lot with to this point. So this is going to be a kind of a time because that happens all of the time in clinicals, right? In the clinical setting. So that's going to be something we're going to introduce here as well. So what is going to happen is that we've got S1s and S2s coming in together. The senior 1 students are going to be the role of the primary nurse, actually providing the care to the patients, and the S2s are going to take the role of patient care technicians or UAPs and or charge nurses. And so they are going to be the people who get delegated to, and they will carry out the delegated tasks in this simulation. So what's going to happen here is that the S1s and S2s will come in, and you will initially receive together as an S1, S2 pair, you will receive report on 3 different patients. Okay, and you can see here what kind of patients you're dealing with. So that kind of helps you think about what kind of things you might expect to be going on with the patients you're going to receive report on. So the S1 and S2 will receive report on these 3 different patients, and together you will look at this report. You're going to get all of your data and analyze that data and determine which one of these patients requires immediate attention. And that's going to be the patient you're going to say, we want to go see this patient. They require immediate attention, and you're going to give the rationale for that decision. After that, you're going to move to phase 2, and this is where you're going to start to provide care, and you're going to, the S1 is going to provide care for that one patient that you decided was the priority patient. This will be the only patient you will see, okay? So the S1 is going to review the chart and the provider orders for that patient. You're going to prepare the medications and any procedures that need to be done on that patient. There will be some embedded errors included on this patient, so you need to watch out for those and be prepared to notify the appropriate person that needs to be notified, and be ready to do any procedures. The S2s will now step back and assume the role of either the UAP or the charge nurse. And so as you are S1s, as you are providing your care, doing focused assessments, giving medications, or performing any procedures, you will start to receive interruptions. For example, the unit secretary may come in and say, hey, you've got a phone call. The doctor wants to talk to you. And you're going to need to decide, is this something that I can ask the UAP to do for me? And then if the answer is yes, then you would say, hey, I need the UAP to go handle this. And you would give them the proper instructions and all the things you need to do for them to go handle it for you. Or you might decide, okay, this isn't appropriate for a UAP, but the charge nurse could handle this for me. And so you would ask for the charge nurse and give them the appropriate instructions. Or you may decide, you know what, I can't ask anybody else to do this for me. I've got to do this myself. And so I will wait till I'm done and then I will handle it. And you would tell the person, okay, I'll deal with that when I'm done, and give that rationale. So that's what's going to happen while you're in the midst of doing these things. And you've got 30 minutes to do all of these things within this scenario. Once you're finished with this part of the sim, you will then go into debriefing. The S1 and the S2 will go into the debriefing. Before we talk about debriefing, let me tell the S2 students what you will be doing. So as the S1 student is getting these interruptions, they will be delegating things to you, the S2. What the S2 student is going to do is, so if something got delegated to an S2 student, you are going to go to the facilitator who will be in the nurse's station in the lab, and you're going to say, hey, I was just delegated this task by the nurse, and it was appropriate for them to delegate this task to me because of X, Y, and Z. And so here is how I would now carry out this task. I would do blah, 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 blah. Or you may say, I was just delegated this task by the nurse and it was not appropriate for this task to be delegated to me because of X, Y, and Z. And so here is now what I would do in order to resolve this situation. Okay, so that's what the S2 students will do with their portion of that sim. Okay, so then you're going to go to phase 3, which is then going to be debriefing, and you're going to debrief all the stuff. That basically is how the simulation is going to run. Let me just quickly walk you through what's going to happen in our little obstacle course. You guys also have this document. You have access to this so you can kind of see what's going to happen. This is going to take about an hour to run through this thing. But this is going to be a hands-on team-based sim. So 6 of you will be in a group together, and there are 6 different challenges that you go through. And this will walk you through all of the different activities. So for example, you can see there's a sterile field that you're going to have to open up some sterile gauze packages and drop them onto the sterile field in 30 seconds. That would be activity 1. Then there are 5 other activities. Some of these activities are hands-on activities where you're actually doing something with sterility, and some of them are questions that you have to answer about the principles of sterility. So each person in your group will take an activity and be responsible for carrying out that activity. There are this is set up for the facilitators in the room to actually give points, and we can have a little competition on this or not. We'll kind of play it by ear and see how that goes. But y'all can look through this and see what the activities are going to be so that you can kind of prepare. The prep work is in the module so that you can look at that and you can kind of see what to expect. I think that is all. We're in the process of, the schedule is done, but we're in the process of creating it in a way that you guys can look at it and it will be a little bit more clear for you, because you're going to come in and do this obstacle course either before or right after you do your simulation. And so we want to make the schedule very clear for you so you know when you're coming and going. So that should be posted very shortly. And I think that's all. And we will see you guys later this week.